Checking one more spot here.
Are we live or not yet?
Yep, we are.
Well,
All
okay,
right. Okay.
cool.
It just clicked over.
And then you're recording?
Yep, and it's recorded.
Cool.
All right. Well, thank you everyone for joining us tonight on a Cancer Conversation and Choices podcast. You're joining three holistic cancer coaches, a couple that are also trained in nutrition, and then I'm also a registered nurse. I'm Marinette Smith. And I am actually going to read our disclaimer real quick. But tonight we're going to go over what Maya and Deborah experienced at the Beljanski conference this last weekend. And I cannot wait to hear about this. You guys have to go check out what the Beljanski conference is online, and you'll see why I'm so excited about it. But yeah, I just cannot wait to hear what they have to say and what they have to share with us tonight. So let me pull up that disclaimer really quick.
Yeah.
The Cancer Conversations and Choices podcast is for general information and purposes only, and it does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and there's no relationship formed with any participant at this time. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of the podcast is not intended to be a substitute for medical professional advice, diagnosis, or treatment. The users should not disregard or delay in obtaining medical advice for any medical condition that they may have and should seek the assistance. Let me actually see what is echoing over here. Okay, I think we're good. So if you take any action or inaction as a result of any content that you consume on the Cancer Conversations and Choices podcast or from their hosts, this is based solely on your decision, and the Cancer Conversations and Choices podcast and the hosts cannot be held liable for any consequences of such action or inaction. Please consult with your doctor or other healthcare professional if you have any other concerns regarding your health, and always seek the advice of your physician or qualified healthcare provider with any questions that you have regarding any medical condition. And this is for educational purposes only. All right, Maya, let's get started. Why don't you introduce yourself for those that are not familiar with you?
Okay, we're waiting for Deborah to join us, but meantime, I'm just going to start. I'm Maya Saman. I'm holistic cancer coach and functional nutrition and lifestyle practitioner. So I am a coach from beatcancer.org. Well, just a little bit about myself before Deborah gets in. I'm a cancer survivor. I went through cancer twice, and I learned second time I decided to do take a holistic approach, and it's been almost a decade. I'm here. I'm healthy. So I'm very happy about it. And we are here on this podcast, are sharing our story and what we learned through our own personal journey, and we would like to share with people to kind of look at outside the box. That's what whole our mission here. So Beljanski Foundation is a foundation that is brings to us a science-based information when it comes to cancer, especially stem cell. We all know that the hard thing is when it comes to cancer is reset the stem cells, for stem cells to start producing healthy cells instead of continue producing cancer cells. I think that's one of the biggest things in conventional treatment. When people go through chemotherapy and radiation, this treatment might kill cancer cells local, but never could destroy stem cells, cancer stem cells. And that's why cancer comes back more aggressively and more intense, and kind of was higher rate of metastasis.
It comes back with like an vengeance, doesn't it? Because those cancer stem cells aren't gone. A lot of the cancer cells can be killed by those conventional treatments, but not necessarily those stem cells. And that's where we run into trouble, correct?
Yes, that's the trouble that it seems the body never gets rid of cancer because the stem cell's still present. Yes. So, and Beljanski Foundation, the research has been done past, I would say 30 years, if not more. They focus on stem cell cancer elimination in the stem cell. And they test many plant-based, it's a plant-based research. So it was a very interesting conference. We highly suggest, recommend to go to the website and check it out. It's a lot of research behind it, and there was a lot of doctors who visited the conference and traveled from many other part of the United States and had a presentation. So it was 2 full days from 9 to 9 p.m. I would say. No, 8 to 9 p.m. Yeah, 8 to 9 p.m. A lot of presenters and a lot of different companies that were showcasing advanced equipments or
Oh, so like different interventions that
different
are not widely
interventions.
known, right?
Yes,
Yeah.
let's say infrared light therapy, urine
Mhm.
therapy, the
Mhm. Oh,
hyperbaric ozone therapy. We're
mhm.
talking, and as I said, certain supplement that directly affect the stem cells. So it was a lot to learn and to go through workshops. Like, it was very busy conference,
Oh, that's so good.
very busy. Yeah. Meeting the doctors. Like, when you hear the doctor on the podcast, it's one thing, but when you meet the doctor in person, it's just completely different vibe. And sitting and listening and asking questions, and it was awesome. It was awesome. I'm so happy that we were able to participate, Deb and I, and we took home a lot of stuff and brought a lot of books to read. So yeah, a lot of book to read. And my personal the people that I really like, the doctors I really like to listen to was Dr. Jean Connelly. I really, really liked her
Mhm.
presentation. It was um, very open and very up to date, and she basically broke it down, many aspects of cancer and the approach, in either just holistic, or it depends on the case, or mix of was very low dose of I think Deb is trying to get in,
Oh,
Annette.
okay.
Yeah.
I don't have any notification to add
Okay.
her.
Let me send her a link.
Okay. Well, and I think for the listeners, one thing,
Yeah.
Sophie, she is the daughter of Dr. Beljansky, correct?
She's a
And they live,
daughter. She's a
yep.
daughter. Yeah, Sophia Beljansky is a doctor. She's a daughter of Professor uh, Beljansky, and he was born and raised in France, but he was deployed from France for the work he was doing,
Mm-hmm.
because of the French government had destroyed health organization in France. They confiscated all of his scientific papers, and they destroyed that. He had to leave France and to be able to freely work and show his research. So her name is Sophia. She's continuing legacy of her father. So the conference was about a couple of things: getting collecting the donation for future research, and this particular research they're working on um, the prostate cancer. So they already have a lot of proven reviews, I mean research. This is a studies on breast cancer, pancreatic cancer, colon cancer, and now they're doing this particular Popiora, I believe so, the plant called
Mm-hmm.
Popioria, that I believe so, that's what the name is. They are doing the research now, and prostate stem cell, prostate cancer stem cell.
Mm-hmm.
So their website has tons of information to go and read, a lot of science there for people. If they're interested, they can go to Beljansky Foundation and find many resources. So extremely, extremely interesting conference where
Mhm.
many science-based studies were presented there. Whether they were mixed with conventional treatments, very low dose of chemotherapy or radiation, it depends on the case, or mixed dose or just holistic, but definitely more than mainstream media,
Has. Well, and these are
mainstream like a medical system is like telling people.
exactly.
Yeah.
Well, and a lot of them share their experience even in their case studies that they've trialed these interventions with
Mhm.
patients. They share it online on Instagram, Facebook. You can find many of these doctors that have been finding a lot of these
Right.
interventions, different interventions that work and have been proven to be successful. And I think that's what's
Right.
really neat about this conference is you gather all those amazing minds in one place and you can
Mhm.
network with everyone and then you can also learn from all of them. And if I'm correct, cancer patients are also encouraged to go to this conference as well, just like
Right.
another conference is correct.
Yes, they were, it was open to the public for people to participate uh, for cancer patients to come and learn about their cases. I really like the dentist, Dr. Gary Guratalo. I
Oh,
believe
I'm not
so.
familiar with him.
Curatolo, I believe
Okay.
so, right? So he's a biological dentist. His presentation was very good. There's a connection and correlation of the dental condition with cancer and other health conditions. It was so fascinating that there's so many things we're still not aware. When we look at the cancer, we always look from in a conventional system, we look to cancer through only one lenses,
Correct. Mhm.
but there's so many different like triggers of cancer. And one of the main ones, actually, it's actually pretty big. Like, it was so fascinating to me. So I had to buy his book so I can learn more about it and read more about it. And he was showing root canals causing the reason of root canals, and not only cavitation, the tooth cavitation, it's a gum cavitation also, that
Oh,
a lot of dentists don't pay attention to those cavitation, but to see those cavitation, you have to have a 3D ultrasound,
yes.
more in-depth ultrasound to see those cavitations, because regular ultrasound does not pick up on those cavitation.
I actually
And
had one of those,
did
and I
you?
had through and I had cancer, and then I still would not get. I wasn't getting better. Like my labs and stuff were still off, and there apparently was some infection literally stuck in the gums, in between the sinuses and the gum tissue. But it was unbelievable. So you just don't even know if it's just sitting there. You don't. Like
Yeah,
I had to
yeah,
really
you
push
do.
because I was feeling terrible. Like I still just could
Right.
not. I felt it didn't feel good. And many people that I talk to, I notice have those issues. Like they'll have abscesses that'll start popping up in
Yeah.
their gums. Lots of teeth removed, lots of root canals, but they'll start having the abscess issue in their mouth,
Yes. Yes.
and then the hiding infections in their gums.
Yes. Hiding infection is the most like common thing that is uh it is completely like, the the dentist won't even correlate to the health conditions, whether it's GI condition or it's like um other health condition, including the cancer.
Hmm.
So the other thing the doctor talked about, it was about oil pulling. He said that it's not as healthy as people think it's healthy. Because
Really?
yes, so he said that you can do a temporary 1 week, maybe 10 days, but you have to stop. You cannot continuously do that because it's interfere with the the microflora of the mouth, which
Hmm.
affect microflora of your digestive system.
That
Because the
makes sense. That
flora you
makes
have in
sense.
your mouth, you when you destroy that flora, then you're gonna destroy your flora in your
Yes.
digestive system and
Mm.
cause more problems down the road.
Hmm.
So very, very interesting. And he is a one of the he is a one of the um top researchers in biodentistry to connect those dots and correlate those dots, like every tease that connects to certain part of the body and
Hmm.
organs. So that was very, very interesting to me. Even though I knew there's a correlation between
Yeah.
dental health and then mouse health and then overall body health, but in details to such an extent, it was
Mhm.
fascinating to listen to him and
Yeah.
listen to his presentation. So I have to get his book to get to learn more in depth. So, and we spoke with him and he said that he will be happy to come and give our beatcancer.org coaches a presentation. So
Oh,
we're
that's
very excited. I
wonderful.
know we're very excited about that one. So down the road,
That's so
hopefully,
wonderful.
uh,
Biological dentistry is just huge. It really is. Once you start really
yes,
diving into it, you understand why we still continue to have issues, health issues all the way around. A lot of
right,
the products even are not very good for our bodies,
right.
that are used in conventional
Yeah.
dentistry. But so did he, I do have a question. Did he say anything about brushing your teeth though on a regular, like daily basis? Like what kind of toothpaste to use? Like, you know,
He,
oil
yeah,
pulling because it gets rid of the good bacteria in your mouth, correct? So if oil pulling is not as good to do all the time, like every day, then
yeah.
what did he recommend for brushing your teeth besides just because I know some people that do like baking soda and coconut oil mixed together, those kind of things.
Yeah.
So did he say anything about that?
I don't think so. He was a big fan of oil pulling or brushing with certain like a toothpaste, even though if they are, he said that many toothpaste, even the healthy toothpaste, they're not as healthy as we think they're healthy. So
Really?
yeah, so it was yeah, it was a great presentation of I'm talking about biological dentistry that Dr. Gary Guratalo, right? Kuratalo, I would say. So it was very interesting. Um, yeah, so he recommended brushing the teeth, but brushing with certain like toothpaste, like the ones that does not contain xylitol. I don't think so. He was a big fan of xylitol
Okay. That makes
or
sense.
other artificial sweeteners, you know,
Yep.
because some people are doing xylitol pulling now.
Oh,
You
that's
know, they do like,
interesting.
yeah, they do that. So he's not a big fan of any oil pulling or anything. He said that you can do it temporary, but not like on a continuous
Honestly.
basis.
Hmm.
Yeah, because it does affect the microbiome of the body.
We're gonna have to go check him out. That's gonna be
Yeah,
some good
yes,
information. Like that's just gonna
exactly.
have to be some deep diving stuff. And then once we get into that, we're
Yes,
gonna be like, oh my gosh, our eyes are
right.
opened. What is this?
Exactly. Exactly.
Oh,
That
that's
is
why I
so
love
true.
this show so much, is bringing this information to people. It's just awesome.
Right.
There's so many
Yeah,
good bits of nuggets, out there.
right. I cannot truly wait for him to come and give us presentation because I would really truly would wanna rewatch his presentation
Hmm.
just to get more in-depth like information on his like he was giving an hour presentation that was still not enough. Yes, yes, and that's the book, The
Yes.
Mouse Body Connection. Awesome, awesome book. Like we both got it signed, and we have a picture with him actually, even.
Oh, that's so cool, you guys. That's so
Yeah, I
cool.
know.
Next
Yeah.
year,
Yes, next year, hopefully.
hopefully, some of those, same doctors and stuff will come back because it sounds like a lot of them, if you do follow them on social media or whatnot, there's a lot of them that are working on their own theories right now and interventions, and they're working on case studies and bringing that all together and sharing it with everyone. And it's just awesome. Some of the work they're doing is so groundbreaking. Um,
Right,
I'm, it's like exciting for such nerds. We get so excited over all the research that they do, but and what
right.
they come up with. So.
You know what I like about this type of conferences that I travel, like, you know, and we travel to see, we see doctors, just the regular MD doctors, either they were touched by cancer themselves and they start seeing the other side, you
Okay.
know, or they are start realizing that conventional treatment is not the only way to, to take
To go.
approach to cancer or any other health condition. So they look outside the box.
Yeah.
They truly look outside the box, and they do presentations and they share their stories. Jen Simmons is one of them. Like, she was a doctor for 25 years until she was diagnosed with cancer, and she was like specialized in, I think she was a surgeon, if I'm not mistaken, right, Deb?
Yes, yes.
She
Uh-huh,
was,
yep.
right? Yeah.
Yep.
She
One of
she
the
would,
leading surgeons in Pennsylvania for breast
Mhm.
reconstructive surgery.
Against
yes, yeah, that's her. Thank you. Yeah. So Dr. Jen Simmons, like, she would remove a female's breast for cancer, but until she got diagnosed with cancer and she started learning more and she started going outside the box. And now she's like a huge advocate of not using mammogram, because mammogram is like, could be carcinogenic and could cause cancer, and she is like, I believe so. She is now, gonna work with RFK Jr. to take it to the next level and start opening more, the clinics that would do a screening, harmless screening, not as aggressive as mammogram is. So
Mhm.
that's what I like about this conferences, like learning more about them and
Yeah.
seeing different ways of,
Mhm.
approaching the cancer, not only the one roadway.
You know, I'm really
Yeah,
glad you actually brought that up because I think that it's interesting. I'm starting to notice like it's just observational. I mean, I think sometimes our thought process shift, especially when you're in healthcare after you've seen so many things happen consistently, the same thing over and over again without a different result. And so it can get kind of
right,
frustrating. And then I
right,
think too, once it's like something happens to you, like when you or yourself or your family, and it's cancer or a significant issue of, um, like I would know what I was going to say, but I'm not going to say it because I don't want to get us in trouble. So,
right,
anyhow, I just think that a lot of times we're all human. So until it really happens to us, sometimes we don't really understand. So those people
right,
that are really taking those stands without having that have already happened to them or their family members, those people are taking like a huge leap of faith because they're going against the brain and the system without having that added backup of I'm trying to get rid of this disease or I'm trying to get, back to balance and all this stuff. I just think it's fascinating when they can see with an open mind the whole big picture that it's just not
right,
this narrow road. There's
right.
just there's this wide road and there's every human is different and
Yes,
everything is going to work differently for each person. And that's what's
exactly.
so neat is they take that perspective and then they use it for people.
Right, right. And even from our own story, sometimes I think like if I would have not got diagnosed with cancer, would I ever come to where am I at right now? I don't think so. I would have. It would have never crossed my mind just sit down and do the research on cancer, just keep doing research, which I've been doing for the past 10 years, and I would have probably not even think about it. The
Mm-hmm.
whole thing, like when all three of us, we all three experienced cancer, and that's why we came to this point, like looking outside the box and learning that there's more out there. And then and what is, beside having more stuff out there, like you have to also realize with what is the right thing and what is the wrong thing, because there's a lot out there and
Mm,
people are so confused, they don't know where to start and how to continue and what to do. Even going through those, like filtering stuff through and
mhm.
learning and just choosing the right things, that's I think like such an important process in healing.
Oh yeah, for sure.
Right,
That information overload is just it'll get you. It'll get you
right,
every time. But it's like
yes.
how do people know what to go with and what not to go with? You know?
It's so
Um,
confusing. I was
it
so
really
confused
is.
all the time. I was so confused all the time. Deb, I did introduce myself. If you want to go introduce yourself, and just like because you came in a little late.
I know. I apologize. I apologize,
That's okay.
everyone. My name's Deborah Herky. I'm a holistic cancer coach with beatcancer.org. And sorry I was late. I had to attend to an emergency. I had to run up north and take my mother-in-law to the emergency room because she had fallen. All is good, but yeah, so we had to do that. So I apologize.
Yeah. No
And I
worries.
didn't get a
Don't
ticket on the
apologize
way back
anymore.
home. So
Yeah.
yeah, love my new little car. Yes. So sorry, I apologize for being late. And
No
I
worries.
know.
Yeah.
Yeah.
I was just sharing my favorite parts of Beljanski conference. So I shared about mine couple. So if you want to share yours couple, but there's more to share, of course, but
Oh my gosh, that's interesting. Uh yeah, you're right. There's more than a couple about this conference that was just amazing. And when you were just talking about, and I'll kind of go add on to that about the doctors, the medical doctors that were there, and taking, whether you want to call it a leap of faith or I think I want to call it passion. These doctors that are there that are changing and looking at things through a different lens and actually taking a chance, to a certain degree, about bringing everything about what they're seeing out to educate everybody about what's out there. Alternatives, just and not necessarily alternatives, yes. However, it's how do I want to say that? Let's put it this way: there's a passion, and like you said, whether or Marinette as well, when you've been touched by this disease, or any disease for that matter, I think a passion gets ignited, especially if it's whether it's yourself or a loved one that, I can't believe this is happening, and you're not happy with the health care that you're getting, that you're receiving, and it's and it's not only during the treatment but after the treatment, the follow up that you're getting, or lack thereof that you're getting. And I think what ignites into people is a passion, and this passion is leading an opportunity for everyone to take a second look about what's happening in our healthcare system. I think it's noble, it's brave, and I will say armor. You're being allowed to armor ourselves through this education about anything that could happen in the future and stuff, and how to, on a daily basis, pre-planning for things in the future to come, or just on a daily basis, and taking control of your own health, and not accepting the status quo anymore, because this is your health, it's your life, and it's life and death.
Yeah.
And if that doesn't make it important, I don't know what would. So I think all of all the medical doctors, the professionals that were there, and non-medical professionals even that were there, was amazing. It was very close knit, as far as you can go up to somebody and talk to them and ask them a question. They're more than happy to answer any sort of question. The quality of the speakers, of course, they're so knowledgeable, and it touched on so many aspects of our health and what is so important, and things that we don't normally get from your doctor, because there's not a whole lot of time, right?
Yes.
Right.
To be able to actually use the time to take the time to ask the questions.
Right.
My hats off to Maison Beljanski and their team, because it was a great conference, and I will go again next year, and I will go to more. I will search out and attend more, because there's so much information to be gleaned from all of these people.
There really
Right.
is. And I think it's as you're talking, I was just envisioning it's almost like a movement. Like we're going back to how medicine used to be practiced. At the turn of the
Yes.
century, even, we're going back to the way that medicine was practiced. We're not changing really anything up. It's just going back to what was previously already done.
Yes. And COVID
Yes.
did that for us.
Yeah.
Believe it or not. I mean, COVID, as much as, as the headaches and everything that it did for us, and taking and looking at it a different lens, it was a blessing.
Yeah.
And like a lot of times, I know for me, cancer was a blessing. I know that sounds crazy to some, but it truly was. Why? Because it's a wake up. It's actually a wake up call. And I was telling this to my husband too. I said, sometimes there was such a spiritual element to this conference
Mhm.
And it was so enlightening, and it was fulfilling. It was fresh. It was like, yes, this is what we need. And when, so when you talk about giving a second chance, you hear that a lot about people's like, yeah, I almost died. I almost died. Well, God gave me a second chance. Whoever the universe gave me a second chance. Heed that. Because sometimes I wonder if COVID wasn't given to us, as harsh as it may be, it's a wake-up call to say, I have provided everything for you. Why not you believe in me and go trust and go forth and conquer, because this is here.
Yes.
Right.
Mhm.
In this,
Well,
believe in me, you will,
Yeah.
be good. And so definitely a very spiritual, moving piece. And so movement in more ways than one.
It was the other thing, the other thing that I did see on both conferences, actually, like Annie Appleseed and this Bill Johnsky, they opened their doors to cancer patients, who are currently fighting cancer, and for them to come and sit down and hear from real people and getting all this information, like when I think I even get the goosebumps right now talking about it, because when I was going through, I was looking for something like that when someone would come and or show me the right way to go, just guide you through. And here they're sitting and they're hearing all this leading like doctors in the field, and they're telling them live, they're on the stage, they're presenting, and for them to grab this information, it was to me, it's like I'm talking about, I'm getting goosebumps because I think it's huge.
Oh,
It's huge. Yeah. And for people don't hesitate, participate in places like that, because it's an eye opener. You're getting the real results, you're getting the real information, you're getting the real, detailed information on so many different ways of looking into the cancer. So it was fascinating. It was truly, truly fascinating to see and to experience everything that, what it was talked about. Of course, like I've been following Dr. Ardis for many years, but seeing him right there on the stage and participating in the workshop, even though I am aware what he talks about, but hearing that, there's so much in there that I was blown away. I was literally blown away.
And you know your stuff, Maya. So, I mean, that's a big deal.
I know. I was literally blown away, even though I know the way he talks, I know what he presents, I know what he shares, but hearing, and then he presented what was fascinating. Deb and I were sitting there, and like he talks and he present all the research is there.
Nice.
And then every question that people would ask him, he would just like literally off of his like a memory would pull up would talk, you gotta go to this research, you gotta go there, you can find this research there. This guy knows what he's talking about.
So you mean that's not just like scripted when you see him? Because like when he speaks online, even you're just like, that guy he has got some speaking capabilities. I thought he had like one of those, what are those, a teleprompter? Like when he's
no.
Videos, really, I'm like, really, he's that good at it, huh? So he's doing something right if his brain is working that well.
Yes.
Well, you know what's funny? What's interesting about that, Marinette, is that it's passion. He's speaking from the heart, and he challenges anybody. He goes, fact check me, ask me any question about this, and I will give you an answer, and I will back it up with facts. He goes, I've got data, I've got everything. He goes, I fact check myself. He goes, to make sure that I've got everything right. And he goes, there's doubters. Of course there's doubters out there. He goes, and there's going to be doubters. He goes, there's going to be people who think it's snake oil. He goes, actually, it's not, it's snake venom. So, but if you don't believe me, do your research, because it's true. So yeah, I mean, but it's passion, and that's what drives it. And it's amazing. And I guarantee he did not script that, because he says, I could probably talk for 2 hours. I'm like, oh, because he had to do one for 6 hours, right? And he's like, what am I going to say? Not a problem. When there is, okay, so what does that tell you? If you can get up and you can talk about everything, not everything, but just about everything that is wrong, or what we've been told and have found out not to be true, and you
Yeah.
can talk for 6 hours. Come on, people.
And it flies like a
You know?
6 minutes. It's fly like a 6 minutes. And you
It's
know, and it's like, of course, it angers me, you know,
Yes.
because
There
we
is that.
were lied about in such an extent, and the humanity has been lied to such an extent, and it's still being lied to, you know. And I've been following him for many years now, and the simple thing, like when he said that what exactly virus is, it blew my mind away. Like I never like, you know, I hear him talk, but I never kind of you know, kind of deep dive into that, like understanding what exactly it is, like, because we all know that the virus is a microorganism, like it's there. But then when he explains what the virus is, it's just, oh my gosh, it's there. It's in the dictionary, but we are so I don't know, we're so blind, I would say, just to go and check it out. You know, it's a Latin word, and the translating from Latin word virus to English, you will see the correct what the virus is. It's not
Really?
what we were even told. Yeah, that blows my mind away. Like, you know,
I'm gonna go Google
So
right now.
right, so very interesting. He had shown us the Latin dictionary, right? So all medical terminology is Latin. It's
Mhm.
Latin based.
Yeah.
So look at
Right.
virus. So I just looked up virus in the English dictionary. Well, okay, I Googled it. All right, so that's not no English
Still,
dictionary. That's
it's still looking
Google.
it up.
So it's
Yeah.
looking it up, and this is Google. This is not a Latin dictionary, right? English, Latin, English
Yep.
dictionary, which says, okay, this is the English version. A virus is a tiny infectious agent that can only replicate inside the living cells of other organisms. It consists of a protein coat, a capsid, surrounding a genetic material, DNA or RNA. Viruses can infect various life forms, including animals, plants, and even bacteria. Okay.
Yeah.
Now I will, somebody out there, or just do your homework. Go look and go pick up a Latin dictionary and look up the term virus.
Okay.
Oh man. gonna
Okay.
look at that right
Okay.
now.
This is like okay.
But
No, just
1871 to 2008, every single version says something similar, except for the little black slimy
Okay.
fish thing that says it's a virus. But what are the two things, Maya?
So this is okay. I'm gonna go for it
Ah.
because I just put like a what is virus in translation from Latin to English. This is on ChatGPT, okay? And I'm gonna read what the ChatGPT gave us. In Latin, the word virus originally meant poison, slime, or venom. Okay, it was used in classical Latin to refer to harmful substances, particularly those of foul or dangerous nature, such as animal venom or a toxic secretion. The modern biological meaning, referring to microscopic infectious agencies, developed much later in the 19th and early 20th centuries. So he explained that how that transitioned to an organism that we call virus.
Wow. Does he
So-
talk about that in his book?
Yes,
Okay.
that basically does not exist, right?
Which I can't show you because I don't have it yet.
My
Yes.
brain's already going
But
like,
yeah, we're gonna receive the book. We're receiving the book, and we're gonna like.
It's
we're gonna-
amazing.
It's amazing.
It's amazing. I would never put the correlation together because
Never.
because I'm being taught this, right? And I'm taught to trust that. And this is the other thing. You're not taught to question anything. You don't
oh
question.
no, you're not really
Yeah.
supposed to.
No.
No,
You're not
I know that
supposed
from my
to.
son. He got in
Isn't
trouble.
that
I don't
good
know how many
science?
times.
Isn't that good
Oh, your
science?
son is
asking questions?
disruptive.
Huh?
That's the whole point of life in general. Ask, be curious. Always be curious. Ask the
Always
question.
be curious. Yeah, that's the whole thing. Always be curious. Always ask yourself a question like, why am I supposed to get this? Why someone tells me this is good for you? Is it truly good for me? So all this question, why someone is selling me this? Is this really like something I need? Why? I mean, there's so many, everyone is trying to sell their supplement. Everyone is trying to, oh my gosh, it's insane. I was just like, there, I mean, infrared light therapy, great. You know, you can get them, but there were like, how many companies was infrared light? You don't even know which are right one to get.
Yeah.
You know,
Yeah.
you gotta do your
Oh.
diligent,
Three or
like,
four
right,
know.
you gotta do your research to know, because every strength of every light therapy, whether it's an infrared or mix of blue light, infrared and other lights, you know, purple lights, you know.
Yeah. So
So
really, isn't it the best thing you can do actually getting out in the sun?
the best thing, of course, getting from the sun, because sun has,
No, that's
yeah,
bad.
yeah, that's bad. That's
Natural
Did I say something
vitamin
wrong?
D.
yes, that
Yeah.
causes cancer. You cannot get that. That causes cancer. That causes skin
Put on that
cancer.
sunscreen.
Yeah.
Slather that
cause it.
sunscreen all over your body.
Yeah, you can put poison sunscreen on your body. That's safe. But getting like a natural sunlight, it's poisonous to the skin. So people think, please, before you put that sunscreen lotion on your body, read the ingredients, please.
Because it's
Right?
baking in. It's baking. Anything you put on you is getting absorbed into the skin, into
Straight
the
to the
body.
skin, straight to the bloodstream, and then the liver. And then people complain that they have, you know, they develop skin cancer or liver damage or other organ damage because you putting a poison literally on your body.
So I have a question for you ladies then.
Yes.
So you were talking about how it was Dr. Artis, right? Talking about the differences in the virus definitions,
Yes.
and how that potentially links together. Did you guys find that throughout the whole conference that the doctors and the speakers were linking such things, like we were just talking about the sun, you know,
Right.
us being told it's not, you know, you shouldn't spend too much time in the sun. You need to put sunscreen on. You need to cover up if you're going to go outside in the sun. But revealing that that's actually the opposite of what we should be doing. So did a lot of those speakers and a lot of those doctors kind of do the same, talk about the same things? Like you should be
Did
doing
they
one
back each
thing,
other up?
but really you shouldn't be doing it.
Yeah, they basically in integrative holistic, like a cancer, you know, doctors, they all talk about not putting anything on your skin.
Mhm.
Because your skin, if you want to avoid that toxic exposure to the sun, you can skip the sun toxic. We're calling toxic in the parentheses because sun cannot be toxic. You know, you can avoid midday, but early morning and then sunrise and sunset are the best time to get your you know, all UV lights that the sun gives. You know, when you look at the rainbow, you see the colors, right?
Oh
Those
yeah.
those are all the light therapies that comes from the sun. They're yellow, they're purple, they're green, they're whatever color is, because that's what our body needs. That's the receptors we have, you know, on our skin that takes everything inside your body and does the job. You know, it does the job, like, you know, methylating vitamin D3, or, you know, there's so many different, like, you know, work those
Rays do. It's
the
like the foundation
sun,
of
like,
health.
yeah,
The sun
exactly.
is literally like the foundation of your health.
Yeah, and they've been and we've been told that that is bad for us. Just put the poison on your skin, and you're gonna prevent yourself from getting melanoma or skin cancer or any other skin cancer.
You know, and I want to preface by saying that we're not saying go out and spend 8 hours in the sun.
Yes, you have to do it safely, right?
I mean, you know, predominantly you're hearing, you know, 15 minutes on the front, 15 minutes on the back, and then cover up within reason. Your body, you know, obviously when you get a sunburn, you're probably getting too much. You know, cover yourself up. I mean, that's you know, just all that we're, you know, trying to say. Be smart about it, you know, and use and use caution and yeah, don't be like, you know, I was when I was 16 and laying out in the sun and using baby oil. Boy,
baby oil. That's a kicker right there. That was such a good
juice
plan,
in the
though,
hair.
Deb.
And make sure you don't wear sunglasses, because wearing sunglasses is basically does the same thing as putting the poison cream on your body, spraying your body with. So
and then it messes with your circadian rhythm too. So then you're like all messed up if you go outside with your sunglasses on. So
it's all crazy.
That is so true.
So I guess I was trying to say too, like, well, I guess us as coaches too, we do so much research and then we find these things that we've been told in masses, you know, like in the mass, avoid the sun, use sunscreen, whatever. That's just an example.
Right.
Whereas we go
Right.
in and we go, okay, well, then why are they telling us to do this? Is this actually factual? Is there something else that we need to find? So I kind of think of it that way. Like going to a conference like this, you get to see a big group of people that's thinking that same way in those same thought processes. Because, and then you have like a group of people that are coming up with, no, you told us this, but we're really starting to see this here. And so just a lot of education to people, right?
Mm-hmm.
Yeah. And the other, I really like the Master Chu Lin.
Oh,
Right?
yes.
He was what was he like a teacher of that's the one. Yes, I know. We got, yeah, that's the book. I got the same book too. Yeah, Master Chu Lin. He is a teacher of the what was it?
Qigong.
Qigong. Yeah,
Qigong.
Qigong.
Mhm.
In
Yeah,
Minnesota.
Qigong. It was just like what I felt like what I felt like when he was doing presentation or meditation. It's like I felt such a like a calm vibe from him, like very calm vibe. The way he spoke, the way he even like, like his entire like a body, it just releases like this calmness.
He's
When you
got an
talk, right?
aura. Yes.
He has this aura of calmness when you talk to him, and he spoke about the movements of Qigong movements and how do they affect different parts of the body,
Mhm.
and how do they like, different things. When you do, you have this blood flow into that part of the body, into that organ that helps to heal from cancer. This he has over 35 years of experience in teaching and
That's
In
a
healing
long
healing.
people.
time. And
In
healing,
healing.
35
Healing.
years.
Yes,
35 years through
yes.
mind, healing through mind, body, and spirit.
Yes, through mind,
Wow.
body, and spirit, and at the same time using Qigong, like, movements,
Mhm.
simple movements. And it was very interesting. I really, really like that too. So like looking forward, I think his book has to be the second one that we can discuss. Like I really like the book. I mean that his presentation
Oh,
was very good. Yeah, and he has teachers, like he had taught many people, and there should be his students like here
mhm.
somewhere in Austin that I want to look for, and I want to take the classes. Like really, really was interesting.
It'd be so good. I actually,
Yeah.
I had followed for a while a guy who had been diagnosed with schizophrenia and some other mental health issues, and he was using Qigong, and that's how you say it, right? Qigong.
Qigong, yeah.
Qigong. Mm-hmm.
He was able to get off of all of his medications, and he found his balance and he found his calm, and it just
Yeah.
completely transformed him as a person, he said. And you can see
Yeah.
it as you're going through. But there's a lot to back up that practice for healing and health.
Right.
A lot of people don't, because we don't talk about it very much. The endocannabinoid system, that's actually what it works on. When you're using those movements,
Right.
you're balancing that endocannabinoid system so that your body can move more like, I think of it kind of like a river, like water flowing.
Mhm.
When
Yeah.
that's
Yeah.
happening.
Yes.
So it really
Yeah.
does work. It's powerful.
Right.
There's a
It-
lot
And
into it.
you run into those blockages, right? So when
Yes.
you're doing
Yes.
acupuncture and that type of thing, or just you get have someone going through your lymphatic drainage, and you going through all your chakras, and be like, oh, I feel a blockage here, and you work through that, and then it just starts flowing. It's like, oh, it's released, and
Yeah.
yeah,
It's
like I said, very spiritual in
very
many
spiritual. Yeah.
aspects.
And fascinating. Like to me, when I would listen to him and just felt it, like there's so much like a wisdom, ancient wisdom. It's in things like that we truly don't want to forget about them.
So very
We
true.
truly have to like hold on to those wisdoms, because they are so related to, like, to me it was like, oh my, like, I was really, really, truly like what related like our connection to this ancient wisdom, to the nature, to everything what he was talking about. It's like when you listen to that, you say, oh, it cannot be true. But the way he would explain, it makes all sense, right? So I
Forgetfulness.
really like
Eskimo
that
too.
one. Yeah, I really liked it. That one too. So I mean, there's a lot of, you don't even know like which one to choose the best, you know, which one to not choose. Yeah.
What was your favorite memory then? We have little under 10 minutes left.
There you
Favorite
go.
memory?
Favorite takeaway? Is
No.
that a tough question?
No, it's not tough. I mean, it's tough because like I really like a lot of things. I think I would still think like Dr. Brian Artis was
Mm,
my like, you know, even though I've been following it, I think I know everything what he talks about, and
yeah.
here he comes and he blows your mind again. You know, that was my biggest thing. Like I was like so fascinated, like just to learn even more in depth, that in the part that I would never think like just to go and just check them out myself, you know.
Oh, yeah.
Yeah, so I think
Yeah.
that's what I like. And then Jonathan Otto, you know,
Oh,
he
he's
was
amazing.
there. Yeah, he's amazing. We spoke to him, I mean, briefly on urine therapy,
I'm
you
little
know.
jelly, girls. I'm a little jelly.
Yeah, and
Oh,
he
you'll meet him. I'm sure you're going to meet him one of these days. Yes.
yeah, and
Well, you
he
got to talk
does
to
like
the guy about urine therapy. That's what's cool.
oh my, yes. Look, so I remember, as I said, like when I was thinking about it this morning, actually, like when I was growing up, like if we had like insect bite or burning or anything like that, the grandma would say like, go urinate on it, right? So
Yes.
this morning I was waking up and this like a urine ate, like when you separate urine and ate,
Mm-hmm.
like,
Mm-hmm.
and I'm like, oh my God, you connect those two together. That's just like, oh my God, you basically gotta eat your urine, connect them together, right?
Yes, yes, that was
That's
your
exactly
neural
because
therapy.
yes, urine therapy, it just like it blows my mind. Like, you know, when you connect the words and you break them down, and then it makes so much sense because urine contains what? Stem cells, your
Yeah.
own stem cells. You know, you just have to know how to properly use them. So he guided us on the places where we can learn about it more.
Mm-hmm.
So, and like, you know, and that was another part, like, very fascinating, very fascinating. And it's like, you don't have to spend a lot of money
Mm-hmm.
to get better. You
Exactly.
have everything right in front of you, basically, within yourself, you know, and that's what like to me is like, you know, okay, we're learning more and more. Like we don't need much out there. We have everything within.
Yes.
And we have
That's
to
so
take,
powerful.
yes, we have to take it from here, you know. That is so powerful. It's like
Mhm.
crazy. Yeah. Loved it, loved it. Yeah.
There were two sayings that there's a couple more, but the ones that strike out to me was one, again, Dr. Brian Artis, who had said, God's pharmacy is greater and better than any medical pharmacy you could ever want, use, and need.
Mhm.
Um, and the other one is Dr. Henry Ely, or Dr. Henley, but everybody calls him Dr. H. But
Yeah.
Henry Ely, you'll hear him as well. He has a book out. It's called The Book of Questions, and it says "Embrace your heart's first thought." And he was going through some, questions and things like that. And one of the things he said, and he wrote it in my book, he said, "Beyond belief is knowing." It's one
Yes.
thing to believe something, but it's another thing to know it. So if you believe, like, it's like, how many of you, it could be for any disease, but I'm going to use cancer just because that's, if you believe your cancer is going to come back, is that as strong as saying, I know my cancer is not going to come back? It's the putting it out to the universe, giving it to God, and just saying, no, I know it's not going to come back. I don't have time for this. I mean, honestly, this is me actually talking, saying that.
Yeah.
I mean,
Yeah.
when I found out, I was like, he goes, oh, I'm sorry. He goes, but this is, he goes, I'm pretty sure it's this. And I'm like, well, number one, pretty sure is not, it is. And number two is I got to go. I have to pick up my son. So I don't have time for this right now. So I'll be talking to you later. And I never went back to him, but I did go to somebody else. So of course, did follow up.
Deb.
Right.
But yeah, that was my first thought. And but I really liked what he said. And he's another incredible dynamic speaker that will really get you thinking. And it's all good. It's very thought provoking. But yes, beyond belief is knowing. And frankly, I want to know.
Yes. Yes.
Yeah.
And he also spoke about, intuition and instinct and, other things.
Intellect, and what does that mean?
Right. Yeah. What does it mean? And I was listening to that, and I'm like, I was thinking, like, because for me, it was intuition, basically instinct. I wouldn't say it was a curiosity, but I think the instinct, the intuition that was like, there has to be something more. That my intuition was sitting inside and was telling me there has to be something more out there than what I've heard. And for someone who worked in the medical system, how, Annette, better than good too. So because we know how the system works, we've been there, we worked there, and having that intuition, there has to be something more, and not giving up on that intuition, at that moment, and not refusing that intuition. I think that's where I ended up now. So if I always think about it, like, what if I would have refused it? What if I would have just let it go and not trust that intuition? So I don't know what I would have ended up at. With my prognosis, they're giving me 15% survival chance, so I don't know what I would have been.
So you had a 15% chance of survival after 5 years?
Yes.
Oh, wow.
I had only 15%, but it's been a decade now. So I'm still here because of my intuition, because my instinct. So it's a message, like, trust your intuition. It's there for a reason. It's there for a reason.
I think all three of us can attest to that. Deb, oh my gosh, like, you have your stories, you guys, we'll have to share our stories, I think, one of these times, but man, you went through it with multiple family members. And if you didn't have that gut feeling, like, who knows what would have happened,
Right. Yes. True. That is so true. We just want to say, like, do not make your mind, logical thinking, overcome your intuition, because sometimes our logical mind goes with what you've been told.
Yes.
Because when I was told that I had 15%, survival rate, but my intuition was telling me something different. So I did not let my logical mind to kind of block that intuition. Do you know what I'm saying? So we have to focus on that intuition instead of focusing on someone else's words, which we don't know if it's true or not.
Exactly.
So that's what he talked about, and I really like that too.
Yeah,
it was very interesting.
You're so right, and it really is. It's our mindset, of how things are going to turn out. Deb, you were the same way. Maya, you just said the same thing. I was the same way, and I mean, I even had surgeons calling me and telling me this is what I need to do. Absolutely not. I knew in my heart, in my gut, that is not what my path was.
Right.
And I think that this is just personal observation again. A lot of people are afraid to speak up. It's an authority. We've been taught that that's an authority over us. And it's not necessarily, I don't think, even in some of the providers, it's out of the provider's hands, because their licenses are also controlled outside of themselves too. So there's lots of other pressure, but we really do have to do what we know is best for ourselves and speak up about it. And if you don't feel comfortable about something, it's your life. Like, literally, it's your life. It's your life. Or somebody else that you love's life. Just speak up.
Right.
And you don't have to be ornery about it. And I'm saying this because just experiencing a few things in the last day. Be curious. Just say, hey, I'm curious. Hey, I'm curious about this. What can you tell me about this? I'm curious.
Yeah.
It helps. You get
Yeah.
a lot more, response by saying, I'm curious if you're, uncomfortable about talking to a medical professional and stuff. Hey, I'm curious about this. What can you tell me about that?
Yeah.
Um,
Yeah, be curious. That's what I would say. Be curious and learning and researching and discovering, right?
right. Now what they say back to you? Well,
Well,
your
there's
response
no
after that.
study. There is no study. We did not research that enough to talk about it or something like that. That's exactly the medical system would tell you. But the thing that research done and they have a science on doesn't do anything, right?
Yes.
So, okay. I mean, I wouldn't say it doesn't do anything. I mean, they do something, but not to the extent that we would like to have.
Yes. Yeah, it's a
Yeah.
different approach. Very,
Right.
very
Right.
different.
So, I
Deb's
got
got
a
a
little reading to do.
Yes.
This is a
Look at
reading.
her.
She's
Oh, and that's not even all of it.
That's not even all. Yeah.
for real.
Yeah.
How many books did you guys each get?
I got 2. I'm gonna order 3 because I have like Jen Simmons' book. I have it at home. I have Leah Canelli's book when it's gonna come out in the summertime, updated version. So I'm gonna get that one.
Okay.
Just waiting for that to come out. I mean, like there's tons of book. We just need tons of time now to read them,
Yes.
right?
I brought
Yes.
nine home with me, and I ordered one, so it's not even
Yeah.
here yet.
Yeah.
Whoa.
Yeah, I was a walking library through the airport.
Yeah.
That would be a heavy bag, Deb, because I know you flew,
It was
didn't
a
you?
very heavy bag.
Right?
It was a heavy bag. Yeah.
It was
Tell me you
was
heavy.
checked some bags. Tell me you
Yeah,
checked
I
a
did
bag.
take a bag,
Okay.
and I had
Yeah.
5 pounds left. I'm like, oh boy, I could have put.
You had 5 pounds left with your 9 books.
Yeah.
I know. Well, yeah, the majority of them, I think, I was carrying them over my shower.
Yeah. I was telling her I can ship them to you if you want to, but Deb want to take her books home.
I don't know. It's so funny. I like
Yeah.
my books, and I love, they're
It's just-
awesome.
It's hard to not keep doing research. Once you
Yeah.
go down this rabbit hole into holistic health, you're like, oh my gosh, there's this whole world out there that I didn't know existed.
Yes.
And it's exciting. It can be overwhelming, but it's also super exciting. You just want to take in as much information as you can
Right.
because it's so
Yeah.
Right. You know,
It is. And it's not all doom and gloom. And I know we come on here, it's like,
Yeah.
oh my gosh, they've been lying to you. Oh, you've done this. Okay, yeah. So maybe they have. So what are you going to do about it?
right.
It's up to you. Everybody's got choices. And we're just here. I'm here just trying to, spread
Right.
the word,
Right.
educate. This is what I've learned. This is what I know. And I believe that to be fact. And I've got facts, the information, the studies to back it up.
Mhm.
Yeah.
You know the story Alice in the Wonderland. It
Mhm.
seems like you're going from one world into the other world, right? Where you see
Yes.
everything
Fall
in
down the rabbit hole.
yes, in completely different ways. That's exactly what these conventions are all about. You kind of come there and then you see all this the completely different world, and you think, is this truly exist?
Yeah.
Sometimes I ask myself, does this truly exist? Even though I went through so many processes myself, I still ask myself a question, is this truly exist? But it does. Yeah.
Yeah.
So I think we're past we're past
Yeah, we're
5
past
minutes.
We are
time, aren't we?
past. Yep. So we'll
Yeah.
end for tonight. We'll see you guys
Mhm.
next week. Join us again Tuesday, 5 p.m. Mountain, 6 p.m. Central, and 7 p.m. Eastern time.